Good morning. The committee will come to order. I want to thank everyone for joining us this morning, and I want to especially thank the witnesses for being here today. Today, over 40 million Americans are burdened by student loans, and as a nation, mounting student debt now stands at nearly $1.5 trillion. Over the past 30 years, the cost of higher education at public four-year institutions has skyrocketed, increasing by 213% from 1988. So, as we begin this hearing, let us acknowledge that this is nothing short of a national crisis. Back home in New York, I have seen how it affects young people in my district who may be taking on multiple jobs to make their student loan payments, only to be compounded by stiff costs of living and a tough job market. Today, student loan debt is now the second highest consumer debt category, higher than both credit card debt and auto loans, and only behind home mortgage debt. This reality has produced a series of ripple effects throughout our economy, including a decline in entrepreneurship. As we often talk about on this committee, starting a business is not without risk to the entrepreneur. And as we search for ways to minimize this risk, we must look at how the burden of what can feel like insurmountable student loan bills affects new business formation. Which brings me to the purpose of today's hearing, where we will be focusing on how the student debt crisis is affecting our medical students and their career decisions. We will examine how student loans push doctors away from starting their own practice, especially in rural and underserved communities. Since the late 1980s, medical school tuition has increased 650%. According to the American Medical Association, the average medical student graduated with a loan burden of over $170,000 in 2014. Starting a private medical practice already comes with its own challenges, like making payroll, finding affordable access to capital, securing a physical location, just to name a few. Combine this with massive student loans bills, and it's not wonder many doctors are deterred from pursuing the great American dream to own and operate their own business. At large healthcare providers, doctors can afford to worry less about administrative costs, making payroll, advertising, or human resources issues. And a stable paycheck is often there to help them pay down their loans. For many medical professionals leaving school with heavy debt, these circumstances may encourage them to choose a large health network over opening their own practice. And the evidence for this isn't just anecdotal. Annual reports by industry have highlighted the slow decline in the number of private practices among medical professionals and an increase in the numbers employed by large providers. But this trend also leaves many communities at a disadvantage without the healthcare providers they need. In underserved and rural communities, medical professionals are needed more than ever to care for an aging population. Yet fewer and fewer students are choosing to serve these areas. By 2030, the Association of American Medical Colleges expect the workforce shortage to expand to over 100,000 doctors nationwide. The greatest need will be for primary care physicians, who are relied upon in every corner of our country to keep ourselves and our families healthy. Yet, rising student loan debt for medical professionals is making the problem far worse by forcing those in the medical profession to choose more highly paid, specialized fields to offset their student loan payments. One way to combat this growing problem is to empower small practices to fill the gaps and provide the necessary care. Make no mistake, incentivizing doctors to open local practices in rural and underserved community is both a small business issue and a public health one. Addressing this issue requires us to have an honest conversation about the rising cost of education in this country, how young people will pay for it, and what to do about the millions of Americans already saddled with record high student loan debt. There are many issues surrounding this discussion, and we must acknowledge its complexity. But I hope this hearing not only sheds light on the burden of student debt in this sector, but help us to reach serious solutions that can empower small businesses, medical professionals, and the communities they serve. With that, I thank each of the witnesses for joining us today, and I look forward to your testimony. I now like to yield to the Ranking Member Chabot for his opening statement.
Thank you, Madam Chair. I'm sure many of us have found ourselves celebrating the recent graduation of family or friends these past several weeks. This joyous occasion marks an important milestone for students shouldering years of intense study and challenging examinations. Graduation day is a triumph, and I'd like to take this opportunity to applaud all of our recent graduates and congratulate them on their achievement. While some recent graduates may be rejoicing on such a day, others may already be counting down the days and dollars until their first student loan repayment. It's no secret that graduate programs, like medical school, come with a premium price tag. There are some programs in place that make that task a little more palatable. The federal government offers a number of student loan programs and repayment plans with terms more generous, actually, than the private sector lenders. Over the years, the federal government has amended its student loan programs to include increased advantages for graduate and professional students, like those enrolled in medical school. The result is that the federal government is paying far more up front compared to the amount that they eventually obtain back from the borrower, and that, of course, means that the federal taxpayers pick up the difference. The Department of Education indicates the agency will lose $28.70 on each $100 in debt wrapped up in these loan repayment plans. Due to the popularity of these programs and repayment options, we've seen federal loan volume increase dramatically. Thus, federal spending in this area has also increased substantially. The Congressional Budget Office projects that the federal student loan program will run a deficit of more than $31 billion over the next decade, with significantly less than projected revenue coming in from direct federal loans. Additionally, a Department of Education Office Inspector General audit revealed that between fiscal years 2011 and 15, the cost of the federal repayment programs ballooned from $1.5 billion to $11.5 billion. It's undeniable that medical practitioners play an indispensable role within our communities. Small medical practices, particularly those operating in underserved areas, are vital to ensuring the health and well-being of Americans who otherwise would not have access to health care. That said, given the over $22 trillion debt our nation faces, I think it's important that we carefully study this issue and clearly understand whether student debt is a significant factor in determining a physician's decision to start or join a small medical practice, or if there are other reasons why a graduate may decide to choose a different career path. And if student debt is a significant factor in these decisions, we should also look at how often physicians are taking advantage of existing repayment programs before creating new ones. As part of that review, I think we need to understand why existing programs are either underutilized or inadequate for medical practitioners, or whether changes to the existing student loan systems can help to alleviate these problems. Of course, as policymakers, we must balance the need to be proper stewards of taxpayer dollars while also encouraging the growth and success of our future healthcare professionals. To accomplish this task, we must ensure that our federal student aid system is efficient, effective, and fair. Madam Chairwoman, I thank you. Yield back my time.
Thank you, Mr. Chabot. The gentleman yields back. And if committee members have an opening statement prepared, we would ask that they be submitted for the record. I would like to take just a minute to explain the timing rules. Each witness gets 5 minutes to testify, and the members get 5 minutes for questioning. There is a lighting system to assist you. The green light will be on when you begin, and the yellow light comes on when you have 1 minute remaining. The red light comes on when you are out of time, and we ask that you stay within the time frame to the best of your ability. I would now like to recognize Ms. Abby Finkenauer from Iowa's 1st District to introduce our first witness. Yes.
Thank you, Madam Chair, and thank you all for being here today. I'd like to, it is my honor actually, to get to introduce our first witness, Dr. Sandy Norby from Des Moines, Iowa. States like Iowa face unique challenges in supporting the small medical practices we need to serve our patients and grow our economy. I'm delighted to welcome an expert from my home state who can uplift these challenges and offer solutions. Many talented providers, even those from Iowa, leave for big cities because they simply can't make enough money locally. Healthcare professionals who stay in Iowa suffer from low reimbursements and have difficulty staying in business. For some providers who are struggling to pay off their massive student loans, practicing in rural and underserved areas is difficult or nearly impossible. I look forward to hearing Dr. Norby's perspective on what Congress can be doing to solve these issues and shore up our rural healthcare workforce. Dr. Norby is a founder and CEO of Hometown Physical Therapy. She received her Bachelor of Science in Exercise Science and Athletic Training and Master's in Physical Therapy from the University of Iowa. In May 2016, she earned her Doctor of Physical Therapy from the University of Montana. She's currently serving as president of the private practice section of the American Physical Therapy Association. Dr. Norby, welcome to Washington, and thank you so much for taking your time today to be here with us and offering so much to us here on this committee. Thank you.
Thank you, Ms. Finkenauer. And our second witness is Dr. Lawrence Wise. Dr. Wise attended Villanova University on a full academic scholarship and graduated in 2011 with a degree in chemical engineering and business. She went on to attend the Rutgers School of Dental Medicine. She's currently in her 3rd and final year of orthodontic residency at the University of Maryland, where she was elected by her co-residents as the chief resident this year. She also successfully defended her master's thesis in April and will be graduating at the end of June with a master's degree in biomedical sciences and certificate in orthodontics. An early congratulations to you. Welcome, Dr. Wise. Our third witness is Dr. Tracy Henry. Dr. Henry is a general internist in the Division of General Medicine and Geriatrics, where she provides primary care to the underserved populations in Atlanta, Georgia. She is an attending physician for inpatient teaching services at Grady Memorial Hospital and assistant medical director and supervising attending in the primary care center. Dr. Henry earned her MS in neuroscience at Tulane University, MD at Georgetown University, and MPH from Johns Hopkins University in Health System and Policy, and a certificate in Finance and Management. She now serves on the American College of Physicians National Health and Public Policy Committee and the National Board of Medical Examiners, including their Diversity and Inclusion Task Force. She's also an assistant professor at the Emory University School of Medicine. Welcome, Dr. Henry. I would now like to yield to our ranking member, Mr. Chabot, to introduce our final witness.
Thank you, Madam Chair. Our final witness is Jason Delisle, who is a resident fellow at the American Enterprise Institute, where he works on higher education financing issues with an emphasis on student loan programs. Mr. Delisle is returning to Capitol Hill today, having served in the past in the Office of Representative Thomas Petri, and then as an analyst for the U.S. Senate Committee on Budget, where he studied the history and mechanics of federal student loans and other financial aid policies. Mr. Delisle has also testified on several occasions before the Education and Labor Committee. Before joining the American Enterprise Institute, Mr. Delisle was the director of the Federal Education Budget Project at New America, where he worked to improve the quality of public information on federal funding for education and supported the advancement of well-targeted federal education policies. Thank you for your participation, Mr. Delisle, and look forward to hearing your testimony as we do hearing the testimony of all the witnesses. And I yield back.
Thank you. The gentleman is back. Ms. Sandy Norby, you are now recognized for 5 minutes.
Thank you. Chairwoman Velasquez, Ranking Member Shaybot, and the members of the House Committee on Small Business. My name is Dr. Sandra Norby, and I am a physical therapist and CEO of Hometown Physical Therapy in Des Moines, Iowa. On behalf of the American Physical Therapy Association and the private practice section of APTA, I thank you for the opportunity to provide testimony on the impact that rising student loan debt has on small practices. Today, I will share with you my perspective on how small medical practices, including physical therapy clinics, struggle to recruit and retain good talent and the significant role that student debt plays in this challenge. My small business consists of 5 clinics in rural Iowa with 25 employees. When we opened our doors 13 years ago, we named our business Hometown Physical Therapy because it represented our desire not only to be part of the local community and economy, but also to hire individuals who had grown up in Iowa's small towns. Hometown people who had gone away to school, earned their degree, and developed expertise, but who wanted to come back to their hometown to practice. One of my clinics is in Lake Mills, Iowa. A recent graduate from the Mayo Clinic College of Physical Therapy and Rehabilitation is engaged to be married to a farmer who lives out 15 miles outside of town. They plan to live and work on that farm, but she is struggling to find a job locally that will compensate her enough so that she can also pay her student loans. My clinic in that town is in high demand, and we treat a variety of patient populations. The patients we treat run the gamut from the student athlete recovering from a concussion, the farmer with low back pain due to long hours in the combine, to seniors receiving or recovering from joint replacement. 45% of our patients there are Medicare beneficiaries, and the need for services for our seniors is growing with the graying of rural America. While our patient load is high, it is not yet high enough to pay a second additional full-time physical therapist. We are currently in negotiation to determine whether or not I can bring her on board and pay her enough of the salary to cover her loans. I knew the risks and opportunities of starting a small business and the variables that come into play when running a small business in a rural area. But one variable stands out that continues to have a growing impact on the ability to recruit and retain staff and keep my business open is the impact of student loan debt. The challenges that small practices face in rural areas in recruiting and retaining providers has been highlighted by the current opioid crisis, the critical need for increased access to non-pharmacological options. However, recruiting therapists, especially those who have expertise in pain management, is a challenge, given the competition for higher-paying salaries offered in urban and suburban areas. There is no easy fix or silver bullet to the complex problem of student debt. There are 2 immediate policy solutions highlighted in my written testimony that both APTA and the private practice section strongly support that would alleviate the burden of student debt on small practices' ability to recruit and retain recent grads. One that I would like to highlight is enactment H.R. 2802, the Physical Therapist Workforce and Patient Access Act of 2019. This bipartisan legislation introduced by Reps. Diana DeGette and John Shimkus would allow physical therapists to participate in the National Health Service Corps Loan Repayment Program. I am grateful for the opportunity to thank Chairwoman Velasquez in person for her co-sponsorship of this legislation. Policy solutions that assist practices in recruiting and retaining graduates with student debt to Iowa and to other rural and underserved communities not only make sense for small business, they assist in improving public health. I truly appreciate the committee's interest in addressing student loan burden of providers who are willing and eager to be part of the engine of the local economy, working in a small business and practice in rural and underserved areas. I look forward to working with the committee, and I am happy to answer any questions you may have.
Thank you, Ms. Norby. Dr. Weiss, you are now recognized for 5 minutes.
Good morning. Good morning, Chairwoman Velasquez and Ranking Member Shabbat. On behalf of the American Association of Orthodontists, thank you for having me here today. I'm honored to share my story about how my student debt burden has greatly changed the plans I have for the future, as well as that of my family. I am currently a third-year orthodontic resident at the University of Maryland in Baltimore and will be graduating at the end of the month. Among other reasons, a dental career enticed me because of the ability to own a practice. Throughout all of my education, I think I made sound financial decisions. I attended college on a full tuition scholarship and worked as a server, intern, and teaching a resident assistant along the way. Rather than attending a private dental school, I stayed in-state and borrowed from my parents to help pay for the first 2 years. I lived very frugally, always had roommates, and never borrowed up to the full cost of attendance, which is currently $92,000 at my dental school. During my last year of dental school, I worked at a satellite location and lived with my parents. My academic success allowed me to pursue a specialty residency program, but dental residencies are unlike medical residencies in that the majority are unpaid and charge tuition. With the match program for residency, I also had less control over which program I could attend and thus the cost of tuition as well. Though it is a state school, the tuition is still expensive, and I had to borrow in excess to help pay my living expenses. Furthermore, my program forbade us from working or moonlighting as a dentist during residency. So I worked part-time as a cater waiter, applied for scholarships, returned excess loan money, and educated myself on student debt. My husband and I share a 2007 Subaru and limit most of our vacations to staying with family and friends. Even with these money-saving strategies and help from my parents, I'm still terrified to face my $411,000 in student loans, with interest accumulating by the day at rates, some of which are over 7%. As I've been searching for jobs, my husband is seriously considering a career change. Although we were delighted when he was accepted into both medical and dental schools, we are carefully considering what it would mean to more than double our existing debt. On the outside, a two-doctor household sounds like it would be more than comfortable, but the reality is that we would face financial ramifications of this decision for the next 15 to 20 years. Most people think that I might be living the high life after I graduate, but the reality is that I'm 30 years old, newly married, moving back in with my parents this summer, and will delay practice ownership and starting a family in order to save money and pay down my student debt. I never imagined the emotional struggles my husband and I would face in making decisions due to my debt burden. While I have seriously considered many employment options, including in rural Wisconsin, I am now primarily focused on corporate dental offices, which offer increased compensation to new graduates and other benefits such as health insurance. While this could be a somewhat satisfying employment opportunity, it is certainly a different experience than many of the orthodontists I know who helped inspire my career path. I would love to pursue my initial goal of business ownership, but the thought of taking out a large business loan in light of my own student debt and that which my husband may take on the coming years is really paralyzing for us. With the median income for orthodontists at $200,000 annually, realistically, I will not be in any position to own a practice for the next 10 or 15 years, especially if we start a family and I begin saving for my own retirement. Of my $411,000 in student loans, I have $256,000 in federal loans, which have already accumulated $35,000 in unpaid interest. With the aggressive standard 10-year repayment plan, my monthly payment will be $3,300, not including that which I'll pay for my parents as well. Overall, on what was initially $256,000, I will pay over $100,000 in interest, which is about 40% of the principal. Many of us consider refinancing the loans with private lenders to reduce the interest rates, but then we lose out on the protections and flexibility of the federal loans. Even though I'm scared to pay my debt, I know plenty of others who have over $600,000 in student debt. Many young orthodontists, including most of my classmates, will be forced to face this harsh reality that they may need to follow a more corporate dental path long-term in lieu of following their dreams of becoming a small business owner and actively participating in their community. Again, thank you for having me here today to speak on this important topic. While I understand higher education policy is not within this committee's jurisdiction, as a medical professional, I look forward to working with you on solutions that will ensure owning a small business practice is still within reach for mine and future generations. I would be happy to answer any questions you may have.
Thank you, Dr. Weiss. Dr. Henry, you're now recognized for 5 minutes.
Thank you, Chairwoman Velasquez and Ranking Member Shabbat, for this opportunity to share my views on behalf of the American College of Physicians on the impact of student loan debt on the medical profession. My name is Dr. Tracy Henry. I am a full-time practicing primary care physician and assistant professor of medicine at Emory University School of Medicine. I also serve as the assistant health director of the Grady Primary Care Center, the largest public hospital in the state of Georgia, where many of my patients are homeless, uninsured, or underinsured. ACP is the largest medical specialty organization in the United States with 154,000 members, including internal medicine specialists, internal medicine subspecialists, medical students, residents, and fellows. I have always envisioned a career in primary care, and I am passionate about being a general internal medicine specialist. I enjoy the problem solving, the complexity of my patient care, connecting with them, and helping them on their journey of health and well-being. My dream has always been to practice medicine in a medically underserved community, stemming from the health inequities that I witnessed growing up. So I was excited when I was offered a position to work at Emory at Grady. However, to my dismay, despite the patient population being medically underserved, I was unable to apply for the National Health Service Corps loan repayment program because Grady is not a designated health professional shortage area, or HPSA. As much as I love working in my current practice, giving back to my community through medicine, service, and training our next generation of doctors, the burden of student loan debt weighs on me heavily. At the end of medical school, I can remember completing my financial aid interview and being told I owed well over the national median for medical student loan debt, which was $200,000. And now, fast forward almost 10 years later, I owe more than double that amount. You see, my loans accrued a great deal of interest during my residency and fellowship when I could not afford to pay on the principal. And despite my timely payments on my repayment program since then, my balance continues to rise. While I find great joy in my work, my student loan debt may prevent me from being able to continue to do so in the future. Further, having physicians of color in clinical settings like mine is paramount, as research has shown that health outcomes for people of color are better when treated by another physician of color. When physicians like myself are financially constrained from working in these clinical settings, our patients suffer. My plan now is to pay off my student loans through the Public Service Loan Forgiveness Program. Under this program, I must have 10 years or 120 on-time student loan payments while working for a nonprofit or government. However, this is a risky proposition, as the current administration has proposed eliminating funding for this program. And even if this funding continues, the vast majority of applications under this program have been rejected. And sometimes my medical students who really enjoy primary care struggle with the decision to choose it as a career. I hear from them concerns like administrative burdens, low reimbursement rates, and even burnout. For all of those issues, I can offer a rebuttal. But when they mention student loan debt to me, that is a harder sell. So in the end, I advise them to go with their heart, do what they enjoy, but I do so cautiously, knowing that this is an issue that I have not yet been able to solve for myself. Even looking for a job in a different clinical setting may not be enough. Private practice is often not an option for many of my residents and myself. They finish training with minimal experience and knowledge of the business side of medicine. The instability of starting and maintaining a private practice will not allow for the work-life balance that many of today's physicians value. And to cover the overhead costs of running a practice and to also keep up on those student loan payments, you will have to see an overwhelming number of patients a day. So the road remains difficult and unclear for internal medicine specialists and other primary care physicians to pay off our student loan debt. However, I am hopeful that there are several steps that Congress can take to reduce student loan debt and, in return, encourage medical students to pursue careers in primary care. So on behalf of the American College of Physicians, I would like to share with you our support of H.R. 2441, What You Can Do for Your Country Act, which would allow increased access for loan forgiveness for individuals who pursue careers in government or nonprofit organizations. Thank you for this opportunity to share my views.
Thank you, Dr. Henry. And Mr. Delay, you are now recognized for 5 minutes.
Thank you, Chairwoman Velasquez and Ranking Member Shabbat, and members of the committee. Thank you for the opportunity to testify today about student loans and debt burdens among graduate and professional students, particularly those who pursue medical professions. I should say at the outset, my testimony today represents my own views and not those of the American Enterprise Institute, which does not take any institutional positions. At the outset, I should say also that I think the premise of this hearing is right on one dimension. When I look at the data and the statistics from the Department of Education, the big increases in student debt are in the graduate and professional space. And particularly medical school. We hear a lot about college affordability and student debt with respect to that. But really, the big change has been among the most advanced degrees. And I should also point out that when we're talking about graduate professional debt, it's almost entirely federal student loans. The federal government lends unlimited money to people who want to pursue graduate and professional programs, including medical students. So whatever the institution charges, and including all living expenses, the students can take that out. Basically, no questions asked. So the institution and the medical school is totally in the driver's seat. They can set their price wherever they want, and the student has access to student loans through the federal government. But I sort of disagree a little bit with one of the other premises here that the federal government hasn't done enough to allow doctors to afford their student loans, or that student loans is sort of the culprit here in preventing them from opening their own practice. There is a program that's been available since 2009 called income-based repayment. It allows anyone with a federal student loan to cap their payments at 10% of discretionary income, regardless of how much debt they have. So if you have $400,000 in loans or $100,000 in loans, your payment is the same, regardless of how much debt you have or what the interest rate is. And after 20 years of payments in this program, your debt's forgiven. So taxpayers have to sort of eat the cost of the loan. And this program, I actually think, this allows doctors who have high debts but want to pursue different careers an affordable monthly payment. So I'm a little bit suspicious that the loans are the sort of the bad guy in driving the whole decision here about whether or not to open a private practice. The loan should be affordable because of this program. But I also want to note that the income-based repayment program is sort of a ticking time bomb. You heard some testimony today about the amount of debt that these borrowers have, hundreds of thousands of dollars. In my testimony, in figures 2 and 3 and 4, I show the projected amount of debt that they're going to have forgiven. It's hundreds of thousands of dollars. So this is a big problem, right? Because here we have people who are some of the highest earners in this country. Dr. Weiss talked about median salary of $200,000, and we're going to have taxpayers forgive their debt, right? And that seems like a sort of misallocation of resources. Highest paid individuals receiving hundreds of thousands of dollars of benefits from the federal government. And the income-based repayment program, the Department of Education tells us 68% of the people enrolled in it pursued graduate and professional degrees. So these are not people who enrolled and dropped out of their community college. They're people with very, very advanced degrees and very high earning potential. The Department of Education also projects that people using income-based repayment, most of them, on average, will earn $100,000 or more while using the program. And so to wrap up, I do want to mention something, and Dr. Henry mentioned it as well, the Public Service Loan Forgiveness Program. I mentioned income-based repayment, you can have your debt forgiven after 20 years of payments. But if you work in any nonprofit job, virtually any nonprofit job or any government job, you have your debt forgiven after just 10 years of payments. The benefits for a doctor in this case would be absolutely enormous. The projected amount of debt forgiven for a typical doctor would be about $200,000 in the public service loan forgiveness if they have a typical level of debt, which is less than what you've heard about today. But here's the curious thing with respect to the premise of this hearing. The premise is we're concerned that doctors aren't opening their own practice. Well, could you receive public service loan forgiveness if you opened your own practice? No. It's not a nonprofit. It's not a governmental entity. So here we have a government program that's supposed to be doing good things and providing huge disincentives for people to open their own practice, which I think is a problem that the committee, at least today, is interested in solving. So when I look at the sort of landscape of student loans, I'm really hard-pressed to think that we don't have enough government money in this program. If anything, we have too much. I have some recommendations on how to rein it in. And I think that we even have so much that it's working at cross purposes with some things that the committee has identified as good outcomes, like people opening their own practices. That concludes my testimony, and I look forward to answering any questions that you may have.
Thank you, Mr. Delay. And I now will start asking questions, but I will recognize myself for 5 minutes. I just would like to share with Mr. Delay that student loan forgiveness program rejects 90% of applicants. And you know what? It is very difficult for us to do oversight. It is very difficult for any committee, especially and particularly education and labor, to assess where we are. This is a very complex issue. You heard the powerful stories that have been shared today, but we cannot, as policymakers, decide what is the best way to proceed when the Department of Education do not provide the documents that have been requested. And then you have the high percentage of applicants that have been rejected. Ms. Norby, in your testimony, you outlined the extensive efforts you made to recruit medical professionals to your community. Can you explain in greater detail how high student loans have affected your ability to attract, hire, and retain employees?
Yes, I will. Thank you for that question. We recently lost a physical therapist in one of our clinics due to marriage and having to move away. She had a relatively short engagement of 6 months, so we had about 6 months to try to find a replacement physical therapist for her. During that time, we had 2 applicants, and that reflects the ability for people to want to move to a rural area compared to my peers in urban areas that get 10 to 15 applicants for an open position. We were able to hire someone who is leaving suburban Chicago to move back to rural Iowa to be closer to her sister. So that's an example of the difficulty of being able to fill open spots that we have.
Thank you. Dr. Weiss, as we have heard, student loan debt can be a factor in determining where you live, what specialty is chosen, future retirement, and when you cross major life milestone. Dr. Weiss, as an incoming orthodontist entering the field, how has student debt influenced your decisions?
Thank you for your question. I think student debt has really influenced both my decisions as well as my husband's. I looked into possibly moving into a more rural location, and just given the situation that we would be put in with my marriage and having to possibly travel back and forth, the income didn't seem to support that at all. It's also impacted what my husband is able to do with his career. And I think even though our median income sounds like it is high as the single earner in a household and paying back for my debt as well as possibly my husband's debt, paying all of our living expenses, starting to save for retirement since I've missed out on about 7 years of retirement savings, then it's definitely made it difficult for us. And as I was saying, I'm looking primarily at working for possible corporate because they can provide a little bit increased compensation for us and really have put on the table being able to start a business at all in the next probably 10 or 15 years.
Thank you. Ms. Tracy, Dr. Henry, one of my top priorities is making sure we're providing the right incentives to encourage business formation, especially in rural and underserved parts of the country. With that in mind, I introduced the Supporting America's Young Entrepreneurs Act of 2019. This bill will cancel $20,000 of student loan debt for the founder of a small business startup in an economically distressed area. Do you think programs like the National Health Service Corp, coupled with legislation I just outlined, could encourage more medical professionals to start a small business in medically underserved areas?
Thank you for that question, Chairwoman Velasquez. Yes, definitely. I think that particular bill that you mentioned, canceling $20,000 of your debt, coupled with the National Health Service Corps, would be more of an incentive to work in an underserved area. But I would add to that, strengthening programs like National Health Service Corps. They're proven programs. We need more funding for those. And we also need to recruit more students, residents, and fellows from medically underserved areas and rural areas, because studies have shown that you're more likely to work and train in those areas if you're from those areas.
Dr. Wise or Dr. Henry or Ms. Norby, are you aware of any other, I know that you mentioned some piece of legislation, but do you know or can you suggest any other piece of legislation that is being submitted here, introduced, that you support?
The American Physical Therapy Association is working on a policy recommendation on workforce diversity that is a collaborative effort between APTA, AOTA, and ASHA that would provide scholarships for students that are ethnically diverse for inclusion and to be able to help offset some of their student loan debt. And that is Congressman Bobby Rush from Illinois will be the lead sponsor on that.
Thank you.
Mm-hmm.
Yes, and I have two other pieces of legislation. HR 2441, the What Can You Do for Your Country Act, which will increase access to loan forgiveness for individuals who pursue careers in government service or nonprofit organizations. And then also the READY Act, or the Resident Education Deferred Interest Act, which is HR 1554. This legislation allows borrowers to qualify for interest-free deferment on their student loans or serving in a medical or dental internship or residency program.
Thank you. My time has expired. I now recognize Mr. Shabbat.
Thank you, Madam Chair. I think that probably we all agree that the amount of tuition that's owed is incredibly huge and a huge drain on the people that have it hanging over their heads and their families, and it's startling. You know, I think it was $1.5 trillion or something like that.
1.5.
It's just huge. Now, the federal government has, in recent decades, has played a much bigger role in funding universities and education and all the rest. Let me ask you this, Mr. Dow. You mentioned, for example, that the federal government gives basically unlimited loans. You can get not only the tuition, but I guess housing and books and all that stuff. You can kind of max it out, and obviously that drives up the cost. And you said 90% are the federal government loans right now. And the universities, and I think this is one of the key points I wanted to make. If you look at how tuition's gone up in recent years compared to other things, it seems like they've gone up a lot more percentage-wise. And is one of the reasons for that because the federal government is so involved and we're kind of dishing out so much money to universities, for example, through student loan programs and a whole range of other things, that we are essentially enabling the universities to continue to raise this tuition, and then therefore people who can take out these loans for everything do that because they want a career and they want to do something good for themselves, their families, and their communities. And so it's a vicious cycle, and where does it end? Is that a, have I?
Yeah. Well, so sort of ironically, I mean, some of the research says no, at least not for medical school. It's not actually driving up the price. And the sort of theory for this, the reason why, is the med school students are such good prospects in the job market that they would be able to secure loans without the government money. Because the earnings, the promise of the earnings and the earnings level is so high that private lenders would make loans to them anyway. So it really isn't what sort of the economists would call a sort of credit-constrained market. But the place, that doesn't mean that there aren't, sort of downsides and negative consequences to the policy. So this income-based repayment program that I'm talking about, the loan forgiveness benefit in it, which is primarily going to graduate professional students. This program, when it first started in 2009, cost about $1 billion a year. Now it costs $14 billion a year. Right? That is a huge change in just a relatively short period of time, and this is the cost of this loan forgiveness. So whether or not the unlimited availability of loans is driving up tuition, we know that it is definitely driving up costs for taxpayers. We can see that in the data from the Department of Education.
Thank you. Dr. Weiss, let me ask you a question. You had indicated, and it sounded like you made every effort to be frugal and responsible, and you ended up still with $400,000+ in debt hanging over your head, and with your husband also considering, a similar career, so perhaps, as you indicated, doubling that. Yet you indicated some of the folks, your colleagues, have even larger debts. Is that, you said you didn't max out all that. You were being responsible and working and trying to make ends meet. The other folks have even more. Is that why the difference, because they took full advantage and put it all on debt?
Thank you for your question. I'm not sure I would say that they maybe took full advantage, I guess, of the system. I think that some of them were maybe not in as ideal of a situation I was, with being able to live with my parents and have additional support provided to me. So I think for some of them, maybe they only were accepted into one particular residency program, and so they had to go there and then they had to live there. And if they didn't know anyone there, depending on the cost of living in that area, they also had to take out additional loans for that as well. So I don't even think any of them really maxed out the cost of attendance as they were perhaps able to do. But I think they still, even with trying to save a little bit, had to take out more and maybe attended more expensive schools as well.
Okay, thank you very much. I've got such short time left, I'm going to yield back at this time.
Thank you. I really appreciate it. I could, so they call votes, and what I'm going to do, we have enough time to recognize the gentle lady from Iowa, Miss Finkenauer, for 5 minutes.
Thank you. And I thank you again, everybody, for being here today. And as a 30-year-old who is also still paying off student loans myself, first-generation college grad, I grew up in rural Iowa. So much of what has been said today, I hear it and I get it, and it is still personal to me and a lot of my friends back in Iowa as well, who I've seen move away because they couldn't afford the opportunity to come back home and have the jobs that pay well enough then to pay off the student loans that they're also sitting with, because, again, they were in different situations where, like myself, my parents couldn't pay for college, and so, we're struggling. And so it's something that we need to continue to keep focused on. And I have a very specific question for Ms. Norby, and also the folks here on the panel as well, if you would like to comment. One of the things I'd like to try to figure out here is if there's ways to incentivize folks to be able to move back to rural areas and start their careers and start their families while also paying off those student loans. And I don't know if there's any appetite at all, or what you guys might think would be helpful, if there's ways to start incentivizing folks who are from areas or who'd moved to areas that's population has either remained stagnant or have lost population in certain years, when right now there's a lot of national conversation about repayment of student loan debt, all of that. And if we are going to go down that road, I'd like to maybe see it focused first on where we could have the most bang for our buck, if that makes sense. And just kind of curious about your take on that, and if you think that may or may not be a good idea or helpful in states like Iowa or Wisconsin or in our rural areas.
Thank you for the question. I definitely see the positive of being able for physical therapists to be able to have some of that student loan repayment. And as I was listening to the other witnesses, it reminded me that, as an entrepreneur, I had to go to banks to get money to start our practices, right? And two of our clinics, we went through the SBA loan process as well. Even though my student loan debt has been paid off for many, many years, I'm a co-signer for my 3 sons on their student loan. And even though my credit score is good, I have a negative impact on my credit score because of their student loan debt comes up on my credit card, on my credit search.
Yep.
So then I was able to secure a small business loan, but the rate that the bank loaned it to me was at a higher percentage. So I think about our company, and we are trying to be a legacy company and encourage people that join our company to become partners so that they can continue the clinic when we decide to retire. And they need to go for a small business loan as well. And if they have high student loan debt, their affordability of doing that is not going to happen.
Yeah. Thank you.
Hi, thank you again for your question. And just to add a little bit to that, I think in my specialty, we have difficulty qualifying for some of the programs that are in place to be able to go back to some rural areas. So I think just kind of putting those systems in place for some specialists as well would be helpful. Also, possibly considering refinancing within the federal program for people who do go to these locations, and even a little bit of a reduction in the interest rates on the loans that we do pay now to possibly go back and work in those places.
That's an interesting way to look at it too. I appreciate that. Thank you.
Thank you.
Yeah.
Right. And I also would like to add that redefining how you define the health professional shortage areas, or HPSAs. So I work in a medically underserved community, but because we have 2 large training programs there in the city of Atlanta, in my area, they consider it not a health professional shortage area because they're counting all the trainees and not actually practicing clinicians. And so maybe changing that would also enable more people to come back to those underserved communities.
Great, thank you. And I know I have to hurry here, but one more thing. Iowa is one of the lowest reimbursement states in the country for Medicare reimbursements. And I've heard from a lot of folks that is one of the biggest reasons why we are lacking in rural providers and desperately need folks in our state and other rural areas who deal with the same situation. Ms. Norby, could you just touch on that specifically of how that may be helpful to attracting folks and how that the low Medicare reimbursement rates is also affecting folks being able to pay off their student loans if they're a physician?
That is a very good question. You have to be very nimble as a small business owner to be able to survive in that kind of environment. And yes, Iowa is actually the lowest paid for the Medicare reimbursement as well. So, but there's people that want to come back and treat their neighbors and their friends, and it is being creative and finding resources that the small business can open and survive within that community.
Thank you. I appreciate it. And Madam Chair, I yield back.
The gentle lady yields back, and I will recognize Mr. Hearn from Oklahoma, ranking member of the Subcommittee on Economic Growth, Tax, and Capital Access, for 5 minutes.
Thank you, Madam Chairwoman, Ranking Member Shabbat, and our witnesses for being here today, testifying on rising student loan debt and the effects it has on small business practices or small medical practice. Like probably most people in this room, I had student debts that I had to pay off over the years. But, you know, it was interesting that my colleague from Iowa brought up about the Medicare reimbursements, also sit on budget. And we just had a committee hearing 2 weeks ago with the deputy director of the CBO, the nonpartisan, you know, kind of guru of all things. And we talked about Medicare for All, which would further lower the reimbursement rates, which really should have you all up in arms, even discussing that. And it would further exacerbate the problems of trying to repay the loans for those of you that are currently in the medical field or working around that. And, you know, student loan debt is a topic that resonates with most Americans. And as the Federal Reserve recently reported, as we've talked about, $1.5 trillion, only second to mortgages held by Americans, and growing every day. However, as dire as the student loan situation may seem, several generous federal loan repayment programs currently exist, including some of them disproportionately advantage the highest earners who accrue the most amount of debt. I would love to ask you a lot of questions, but I have an expert sitting right next to me who's done exactly what you all are talking about. My colleague from Pennsylvania, Dr. Joyce, who he and his wife own a practice together, who are both doctors. So I'm going to yield the balance of my time, Madam Chairwoman, to Dr. Joyce.
Thank you, Madam Chairwoman. Dr. Norby, Dr. Weiss, Dr. Henry, Mr. Delisle, thank you for being here. I, too, have been inducted as a fellow in the American College of Physicians after doing a primary care residency in Johns Hopkins in general internal medicine. With my wife, I opened a small business in rural South Central Pennsylvania. But prior to that, I did additional training at Johns Hopkins in dermatology. So my terminal degree occurred when I was 32 years old. I finished with significant debt. I recognized that. We worked hard together. We didn't have all the luxuries in life. I had no referral as far as the ability to pay those loans back, but I did. I didn't default on one of those. I feel your pain. I know that in Pennsylvania, we are grossly underserved by primary care physicians, particularly in the 10 counties that I represent in South Central Pennsylvania. I know that the students who come back to our areas often are over $500,000 in debt. I realize that many of them stay in the large metropolitan areas because they can make more money. I realize that the Medicare reimbursement rate is something that definitely needs to be addressed. And when Representative Finkenauer brought that up, I'll take that off of my discussion point. But I will want to mention to you that it is absolutely important that we support legislation such as H.R. 1554, the READY Act, which would allow students to defer interest, what you have talked to us about, to defer interest on their student loans until the completion of their medical residency or their dental residency programs. This is important. This is a bipartisan bill with strong support on both sides of the aisle, which could have an immediate impact, which could have an impact in primary care physicians returning to the areas where they grew up, as you have pointed out to us. It's so happy to have these people, to welcome them back into their communities. I would welcome the ability to work with my colleagues to try to advance this bill. But it's also something Mr. Delisle pointed out. We have to note that student debt is far from the only barrier that prevents private practice for doctors today. The major structural impact is the reimbursement under Medicare for procedures, which can occur much higher in hospital settings versus in the doctor's office. This has driven and is driving many private practices to sell their private practices to hospital systems. It discourages individuals from entering into private practice. My questions are more comments here today. We are advocates. We are bipartisan advocates. Our chairwoman, our ranking member, we understand the importance of having physicians in private practice. I leave with the overwhelming encouragement that every Republican and Democrat work together to sponsor, to pass the READY Act, H.R. 1554, and the importance of that for encouraging medical practices in the rural communities. Thank you. Thank you, Madam Chairwoman. I see that I'll yield back the rest of my time.
Dr. Joyce yields back, and thank you so much for your powerful statement and, being able to shed light into this issue, given the fact that you are a doctor. But the committee stands on recess, and we are coming back after the votes. But yes. Okay. All right. Okay. We stand in recess. Thank you.
The committee will now come to order. I'd like to now recognize myself for 5 minutes of questioning. Thank you to all the witnesses for being here, and to Mr. Hagedorn for returning. So many people in my district, I represent the Kansas 3rd Congressional District, are struggling with student loans. I know because I am one of them. I know we've heard that from a few members here today. I personally understand how stressful it can be to deal with the burden of student loan debt. That's why I've co-sponsored legislation like the Empower Participation and Repayment Act of 2019, which incentivizes employers and expands tax exclusions to help pay off your student loans. How much student loan debt you have should not be the first thing that you're thinking about, or that physicians particularly are thinking about when deciding where to live, where to practice, how to practice. And with the looming physician shortage that I have heard a lot about, I know it's necessary for us to discuss the issue of rising medical student loan debt and its effect on small medical practices. Physician shortfalls affect healthcare access and outcomes across the country, but even more so, it impacts underserved and rural areas. I'm especially concerned about the decreasing number of physicians who are choosing to practice primary care due to their burdensome student loan debt. The American Academy of Family Physicians, which is headquartered in the district that I represent in Lenexa, anticipates an outsized shortage of primary care physicians by 2031 as compared to other specialties. So the first question I'd like to ask is, Dr. Henry, the Public Service Loan Forgiveness Program has turned down 99% of the program applicants as of 2018. How is this, from your point of view, affecting the medical field, particularly primary care and internal medicine physicians like yourself?
Thank you for the question, Ms. Davis. It is greatly affecting our field. As I mentioned in my testimony, I work with internal medicine resident physicians, and currently about 80% of our internal medicine residents specialize. Of that 20%, 10 are hospitalists, and then there's left with just 10 going into primary care. And a big part of that is the student loan debt burden. When they think about becoming a specialist, being a primary care physician, you make anywhere from 30 to 50% less as a specialist. And so when they're factoring in that they need to be able to pay back their loans in a timely fashion, they choose specialty over primary care. And then particularly for myself, without the public service loan forgiveness or programs like that, it would prohibit physicians like me from going in those areas.
I'd invite any of the other panelists if you want to follow up on that before I ask my next question. No? Okay.
I would just add that the high rates of denial in the public service loan forgiveness program stem from the fact of the rules that Congress put in place around it to actually limit who could get the loan forgiveness as a way to save money. And so you have to have the right kind of loans, and you have to be making regular payments. And so what I think what we're seeing is that as people apply for it, they're sort of surprised to learn of these very complicated rules that were put into place when it was created. So it isn't as if people are being denied in error. It seems to me that they're actually being denied for actual reasons that exist in the program. But many of that that's going to disappear into the future because as of 2010, everybody has the right kind of loans to qualify for public service loan forgiveness.
Thank you. I appreciate that. And I might follow up with you for some additional information about that. But I guess I'd like to know whether or not the public service loan forgiveness program further, would elimination of that program further exacerbate, or some of these policy changes increase accessibility and, help ensure that high need areas have primary care physicians and that people aren't making different choices based on that?
Yes, thank you. Without the public service loan program, a medical degree would be increasingly out of reach to physicians like myself who contribute to the diversity of the healthcare workforce and are committed to increasing the healthcare, working to meet the healthcare needs of our medically underserved population.
Thank you. And so I won't ask any more questions. I'll yield back and would like to recognize Rep. Hagedorn for 5 minutes to ask questions.
Thank you, Madam Chair. I represent 1st District of Minnesota, southern part of Minnesota, a lot of rural areas. And so we're continuously working with folks and trying to make sure that people who live in underserved and rural areas have access to timely, quality medical care, making sure that we can lure physicians in there as best as possible and have some incentives if needed. I recently testified in front of the HHS Labor Subcommittee and said that I support a grant program that would allow doctors to go into rural areas and to practice there. I happened to be joined that day by 3 students at the Mayo Clinic who happened to be just in town on that kind of an issue, and they wanted to be both doctors and researchers. And so whatever we can do in these areas, I'm sympathetic and supportive. I also don't begrudge folks who get into the profession of medicine who over time are accomplished and make money. You take great risks. You put a lot of time into it, and you should be rewarded for your talents. You're saving lives, you're improving lives, and doing wonderful things, and we never want to discourage that. The same way in our system, I don't think we ever want to discourage medical technology, prescription drug advances, and things of that nature. The United States is the envy of the world when it comes to medical care, and we need to preserve that. One of the things I think will be helpful in the future, legislation that we're working on, we should be introducing soon, we'll look for support from in a bipartisan fashion, is the concept of letting you pay back education loans, letting everyone pay back education loans with pre-tax dollars. That seems to me just common sense. I was at the Houston County Fair many years ago. I was campaigning, and somebody walked up and said, how come we can't use pre-tax dollars to pay back these education loans? I said, well, I don't know. It just makes sense. We should get on that. So that's one of the things that we're working on in Congress. Many of you have talked about the concept of physicians going into underserved areas and trying to open up practices, and that's important. But I think what you'll find that is, based upon my interactions in southern Minnesota, is that just as important as paying back debt and things of that nature, you have some government regulations to deal with that drive up your costs. You have all sorts of impediments as being small business people that drive up your costs and make it very difficult. And one of the things that we have to look at is this concept of single payer, Medicare for all. A lot of people are pushing that. They think it's going to be some panacea. I disagree, particularly for physicians who want to have their own practice or those that want to serve in rural areas. 50 cent on the dollar reimbursement does not sustain the model of our hospitals and our fine institutions of medicine in rural areas. And if you want to pay back your loans, you need to make money. And when the federal government comes and with 50 cent on the dollar reimbursement, you're going to have a tough time. Now, I've brought up a few things. I'll start here, and please just respond to anything I've said.
Thank you, and we live in Okoboji if we're close to your district.
Well,
so.
you can always move.
There we go.
Come right into Minnesota.
One thing that I was thinking of when you were stating your statement was, as a physical therapist, we completely embrace the fact that we need our primary care physicians as well in our communities. I need to go see my primary care physician at times as well and don't want to drive over an hour to do that. One thing that I touched upon was the opioid epidemic, and physical therapists, we're the musculoskeletal experts in the field, and we have something called direct access. So if you woke up and you couldn't stand up straight and your back hurt, you could call your physical therapist and get in that same day and actually receive treatment that would solve the cause of the problem. And so working collaboratively with the other healthcare professionals that would be attracted to those underserved areas is really one of our main goals.
Thank you.
Thank you very much for your comments, and I appreciate them. Something that touched me, I think, was being able to use pre-tax dollars to pay for some of those student loans, and I think we very much support that idea. Would be fantastic, and going along with that, I know in the Senate there's a bipartisan act called the Student Loan Tax Elimination Act of 2019 to eliminate the origination fees of federal loans, and I think that kind of goes along with using pre-tax dollars. I think it all kind of just adds up, and any little areas where we can focus on reducing that would be a very great help.
Thank you. Okay. Doctor.
Yes, thank you also for your comments. I also agree with the idea of being able to pay back our loans with pre-tax dollars. In fact, anecdotally, when I called my lender, I asked, so how are you figuring this amount out? Why am I paying nearly 25% of my take-home pay on student loans? And then they said they use your total AGI, your adjusted gross income, and then they use some sort of numbers. But when I pay my loans back, I'm paying after taxes. And so the take-home pay is all, it's just 25% after taxes is not enough to start and maintain a private practice. So I think that idea that you guys are bringing up in Congress would be perfect.
Concept would be you have to go work for the money, earn it, and then at least you can pay back those loans with that. I guess we've run out of time for our last witness, unless you want to give them 1 minute. Would that be okay? 1 minute?
Yes, go
Anything,
ahead.
sir?
Go ahead and answer.
Well, I think that they, paying the loans back with pre-tax dollars. I mean, I think one of the issues that we're starting to see in the federal student loan program is it's been layered on over and over and over again with different benefits and bells and whistles, and it really is. You can see that's proving very frustrating for people who are using the program. So I would actually sort of argue in the opposite. I would make the system simpler and make the make the benefits very clear and transparent, rather than multiple ones that are sort of hard for people to understand.
Okay. Thank you. I appreciate your testimony. It's nice to see you today. Thank you.
The gentleman yields back, and I'd like to now recognize Rep. Judy Chu, who is the chairwoman of the Subcommittee on Investigations, Oversight, and Regulations.
Thank you so much. Dr. Weiss, in 2011, Congress passed the Budget Control Act, which drastically cut government spending and included a measure to strip graduate students of their eligibility to receive subsidized federal loans. So, since 2015, I've introduced the Post-Grad Act, a bill which would reinstate subsidized federal loans for graduate students, and I will be reintroducing that bill soon. If enacted, it would allow graduate students in medical fields to complete their studies without interest accumulating on their loans. You mentioned the burden that you've experienced from your loans accumulating interest during your schooling and residency. Do you believe that if your loans were subsidized, you would be in a better position to open a private practice or work in underserved areas?
Thank you very much for your question, and I absolutely agree with that. I think it's a fantastic idea to bring back the subsidized graduate student loans so that that interest doesn't continue to accrue while you're in training and unable to pay down the principal or the interest on those loans. We get a lot of communication from our loan servicers recommending to pay down on the interest, and we're just unable to do that. There's really no other source of income besides our student loans, so I think that would greatly help us, and going along with that, with the READY Act, I think is fantastic to be able to defer the loan payments while in residency as well. Thank you.
Thank you for that. Dr. Henry, House Democrats last Congress passed the AIM Higher Act, a comprehensive reauthorization of the Higher Education Act. And included in that bill was a proposal to extend Pell Grant eligibility from 12 to 14 semesters and allow students to apply their unused Pell eligibility to their graduate studies. Right now, students who do not use all 12 semesters of their Pell eligibility as undergraduates are ineligible to receive the rest of the grant as graduate students. But the AIM Higher Act would enable a student who receives a Pell Grant for 8 semesters for their bachelor's degree to use their final 6 semesters of eligibility during graduate school. Do you believe this change would increase the number of students from low-income backgrounds that are able to pursue medical degrees at schools like Emory University?
Yes, thank you for the question. Definitely, I was a Pell Grant recipient for my undergraduate education, and it was not until my graduate education that I started accruing private loans and loans that are unsubsidized. So being able to transfer that money over from undergraduate to your graduate degree will definitely enable people from communities like mine to pursue a medical degree, and from private universities like Emory University.
Well, thank you for that. And just to continue on, I am one of two psychologists in Congress, so I feel this issue very keenly. And I wanted to ask about the shortage, Dr. Henry, of mental health professionals across the country. According to the Department of Health and Human Services, nearly 7,000 mental health practitioners are needed across the U.S. My legislation, H.R. 2958, the Increasing Access to Mental Health in Schools Act, would reduce the cost of postgraduate education for mental health professionals that work in high-need schools, and it would help address the shortage of mental health resources for students, but the need goes far beyond schools. Can you talk about the long-term effects in communities that have a shortage of medical professionals, including mental health providers?
Yes, thank you for that question. Actually, I work in an integrated care setting where we're moving towards integrated practices, meaning mental health and substance abuse in our primary care setting at Grady Hospital. As an internal medicine doctor, I'm working very closely with our psychologists, with the social workers, and also with their training programs to work together to help alleviate that shortage. One answer to the shortage is actually working together and training up our primary care physicians, because most of the patients that we see with who meet the diagnosed criterion for a mental health disorder, we refer them out, only a third actually see a psychologist or psychiatrist, a mental health professional. So I think if we work together with collaborative care, we will actually help to address some of that shortage, because we can provide more of that in the primary care setting.
Very good. And Dr. Norby, as a small business owner, you know of the financial pressures involved with a private practice, and yet we see many hospitals acquiring private practices. Do you believe that rising student loan debt has created an incentive for independent providers to sell their practices to hospitals?
Yes, I very much agree with that, and would be remiss to not say thank you for co-sponsoring HR 2802 before I answer your question. We see that a lot in consolidation as well in physical therapy practices, more of a corporate purchasing of the practices, which has caused restraints on the ability for a physical therapist to really practice to the full extent of their license.
Thank you. I yield back.
Thank you. The gentlelady yields back. Well, thank you very much. I'm sure the entire committee here would like to thank all the witnesses for taking the time out of their schedules to be here with us today. As Chairwoman Velasquez said earlier, student debt is having an economic impact on all of our communities. Those that are just starting college, on their way to the workforce all understand the obstacles and burden that student debt has on life decisions. Whether it's trying to decide on a specialty, where to practice, student debt has weighed heavily on medical professionals and their ability to enter into private practice. This is why we must take the necessary steps to address the rising costs of education and student loan debt, particularly in healthcare, so that Americans can receive the care they deserve. I look forward to working with my colleagues on both sides of the aisle to address this very important issue. I would ask unanimous consent that members have 5 legislative days to submit statements and supporting materials for the record. Without objection, so ordered. And if there's no further business that comes before this committee, we are adjourned. Thank you.
Very good.